Assalamualaikum and greetings. My name is Mizati. I'm from Faculty of Medicine, UiTM. I'm a general surgeon, one of the lecturers in the surgery department. So I'll just give an overview about blood investigations in thyroid carcinoma. So is there a specific blood investigation that can diagnose thyroid carcinoma? So the answer to that is no. Okay, but however, there are certain tests, certain blood investigation that is done primarily either to assess the function of the thyroid or to prognosticate the patient. I'll go through that with you one by one. So a thyroid function test is important for any patient who presents with a thyroid swelling or complaints related to the thyroid. Basically, we want to know the biochemical status, thyroid status of the patient, whether the patient is hypothyroid, hypothyroid, or euthyroid. It is very rare for a patient who has thyroid carcinoma to be hypo or hypothyroid. Okay. However, in someone who has been diagnosed with thyroid carcinoma and has undergone treatment, so the thyroid function test is important in terms of surveillance and in terms of assessing whether adequate suppression is being done. So if you want to suppress the TSH, so thyroid function test consists of the thyroid stimulating hormone and the T4 plus minus the T3 levels, right? So in someone in their post-treatment phase, we want to ensure that the thyroid that the TSH is adequately suppressed. If it's not adequately suppressed, then it can stimulate any residual thyroid neoplastic tissue and stimulates growth. But in the diagnostic phase is to assess the function of the thyroid. So thyroglobulin is a glycoprotein which is synthesized in the thyroid gland. It is elevated in certain benign conditions and also in thyroid carcinoma. So to use it as a diagnostic tool is not advisable, as you know, it's elevated due to many reasons. So, and even if in someone with thyroid carcinoma, an elevated thyroglobulin level does not indicate whether the patient might have already uh, lymph node metastases or the aggressiveness of the tumor. So it is not helpful in the initial stages. However, it is very helpful during surveillance, whereby an increased thyroglobulin after the patient has undergone treatment would indicate a possibility of recurrence. Okay, for medullary thyroid carcinoma, so there are two blood investigations that is particular for this thyroid carcinoma, okay, which is not used for other types of thyroid carcinoma. So in particular for medullary thyroid carcinoma, there is the CEA and calcitonin. So calcitonin is actually a hormone which is produced by the parafollicular cells, which inhibit osteoclast activity. So the parafollicular cells is where medullary thyroid carcinoma arises from. So an increased risk in calcitonin initially might be the first indicator that the patient has MTC. So it used to be whereby a patient who is at risk of medullary thyroid carcinoma, i.e. has a relative in medullary thyroid carcinoma, you would check their calcitonin level, and an increase in calcitonin level would indicate that there might be MTC for that patient as well. Although in centers or in places where there is genetic testing, genetic testing for the red proto-oncogene mutation would be more accurate. Okay, so calcitonin is also used in the post-operative period after treatment for surveillance as well. So an increased risk of calcitonin after surveillance might indicate recurrence. For CEA, CEA is carcinoembryonic antigen. So CEA is a tumor marker which is also used in colon carcinoma as a surveillance tool. So CEA is raised in other types of benign conditions as well, and even when someone is smoking can have an elevated CA. In the diagnose, it does not diagnose, it is not a tool to use for diagnosis. So an elevated CA in someone with a thyroid swelling does not indicate that the patient has medullary thyroid carcinoma. However, in someone with with medullary thyroid carcinoma, a preoperative CA might indicate the so an elevated CA might indicate disease progression, whereby they might already have lymph node metastasis or distant metastasis. So it can be used as a prognostic indicator. It is also used for surveillance, which means any elevation of CA post-operatively or post-operatively could indicate recurrence. Alright, so to recap, there is no one blood investigation that can diagnose thyroid carcinoma. However, all the blood tests that have been described previously have some role in the initial period to assess the function of the thyroid, or as a prognostic tool, and subsequently for surveillance after the initial treatment has been done. Okay, thank you.